So here, so before going to start the examination, so we have to explain clearly about the what we are going to do. So in this one, and also we have to take the history of in the from the patients. So how to explain the importance of the history information for the complete assessment of the patient health. So we have to explain to the patients in the to the patient. So he is going to be comfortable. So that means so what we are going to do. So he can understand, and also he is going to cooperate to the examinations. And also reassure the patient that all responses will be kept strictly confidential. So we have to reassure, that means we have to give the more like a should give the confidence to the patients. That means we are not going to reveal the any like information to the other people. And also utilize gathered informations as a roadmap in directing your physical examinations. So what we are going to take the informations, so it will give the complete clue about the conditions. We are going to get the roadmap for the physical examinations. So here we have to explain. So here we have to inform to the patients. I would like to ask you some important question about your urinary and also reproductive system, as well as your sexual lifestyle. So if you ask the patients, so he's going to be comfortable, and also he is going to give the complete history of about his problems. So these are the important questions that routinely asked for the all my male patients, and should not feel embarrassed. And also your response will help to develop the complete picture of your overall health. So that means we have to discuss about the all the information regarding the patient health issues, and also you should not be embarrassed, should be a professional, so while examining the genitourinary system. So here, adapt the questions to the age appropriate to each patient. So according to the age of the patients, we have to ask the questions regarding the, to know the information history about the conditions. So in case of the younger males, so ask about the testicular health, and also the sexual practice, and in the sexual transmitted diseases. Have to ask in the younger males about the sexual health, so, and also any diseases, sexually transmitted diseases, about the testicular health. And also in case of the middle age and also older males, so main important thing is how to ask about the prostate health. So because of in the middle age and old age, these complications are going to be high regarding the prostate cancer, and also benign like a hyperplasia of the prostate, so enlargement of the prostate gland. And also sexual and also urinary issues associated with dysfunctions. So such as any pain during the sexual intercourse, or during the urine, the voiding the urine, or any changes in the urine or bowel habits, or difficulty passing the urine, or any incontinence, or in the dysuria, or painful urinations, or maybe the oligouria or polyuria, that means a less amount of urination, or is a frequent urination, or any urgency, or in case of any bowel like habits, constipations, or the diarrhea, or incontinence of the bowel, like in the fecal incontinence, and also in case of any erectile dysfunctions. So in the erectile dysfunction, any abnormality in the erection of the like a penis, or maybe is any impotency. So these symptoms we have to ask according to the age groups. So before that, starting the examinations, so we have to prepare the patients. So he is going to be comfortable. So the communication will be two ways. So here is going to be, if we give them more comfort to the patient is going to be relaxed, and is going to communicate freely. So if we get the communications free, so that means is that if we communicating two ways, so we are going to get the more information about the conditions, so we can conclude the conditions about the diagnosis. So before conducting the exam, conduct the end of the physical examinations. So here we have to explain the reason for the genital and also rectal examinations. To the patients, we have to explain why we are doing the genital examination and also rectal examinations. So what are the major complications related to the genital and also rectal complications? And also reassure the patient that there should be no pain associated with the exam, but it is very important that they report if they noticed. So because of sometimes may chance to get the pain, but we try to avoid the pains. So we have to explain clearly. So I'm going to assess your genital region. We are going to assess your rectal regions. So I'm going to do this procedure. I'm going to hold I'm going to insert the finger into the rectum. So these type of communications. So this will, I'm going to check for your abnormality in the rectum, or any abnormality in the scrotum region, or in the penis regions. So I'm going to place my finger pads over your scrotum or maybe testis. So these things communications. So this is going to identify any swelling, any mass, any lymphadenoma. So if you explain in this manner, the patient also going to be comfortable, and also he is also going to ask many questions. So the communication will be in the two ways. So the depends upon the communication only, we are going to get the more information about the problems. So that's the reasons we have to prepare the patient first. And also position is of the patient is important. So position yourself on the stool facing to the patients. So the physician has to sit on the stool. The patient should stand and also facing to the physicians. Ask the patient stand close to the exam table. So with the feet spread and also feet spread to the shoulder width. So because of the standing position, sometimes if the age group may chance to get the loss of balance. So in this, that's the reason we have to ask them to standing in the the width, like a space. So in this condition, the base of the support is going to be increased. So this may require the patient remove his pant to minimize the loss of balance. So we can prevent the loss of the balance. Stay in touch with the patient by placing the periodic eye contact and also frequently asking. So if like a questions we have to ask, and also the patient and also physician should like a eye contact should be there. So so this one is, how are you doing? So how are you doing okay? So if you ask some questions, so it's going to be, it's like a more like a two-way communications, the examination will be easier.